Hi everyone, this is Dr. Heather Austin Robillard, and today's lecture video is going to teach you a little bit about how to select good tests when it comes to creating a substance abuse evaluation. Remember, we are in the section of gathering information with the use of psychological tests. And so for this lecture, we're talking about how would you know to choose a good test. In the ICRC exam, it's important to know this information because you will be tested on screening, brief intervention and referral for treatment, selecting and administering assessment instruments, gathering and assessing information. You'll need to understand the knowledge of appropriate screening and assessment tools, screening and identification of issues outside of the scope of your practice, use of screening and assessment instruments, and then how you interpret the results of those screening and assessment tools, as well as interpreting the results to be able to integrate this available information and formulate a diagnostic impression or determine appropriate course of action. So if you remember in the previous module, we covered different distributions, the central tendencies like mean, median, and mode, measurement variability like standard deviation, standard scores, and how we can use these and how this information is used for score interpretation. So let's say that you have an assessment tool and you receive a score or a total for that score in the assessment tool. What does that mean? What does the number or the score mean for you and your client? For example, let's say we have a raw score of 107 on a measurement tool. The mean is 4.7 and the percent is 70%. Again, what does this mean? Here are some popular methods for interpretation of a score. There is normative referencing, so we look at the norm and the current referencing of that norm, so where it's listed from the norm. Then we can look at fixed group referencing. Where does the group tend to norm? Another popular method of interpretation is criterion referencing. This is typically set by the test constructor, and it is usually based empirically off of specific criterion. Let's use your college course tests as an example. Say that you got a 70% on the exam. Is that good? Well, it depends on what method of interpretation we're using. If we are using a norm referencing, 70% is great because it is higher than 95% of your current classmates. This is norm or current referencing. If we are using criterion referenced, this compares a student's knowledge and skills against a predetermined standard or a cutoff score or criterion. In criterion reference tests, the performance of the other students doesn't actually affect the student's score. So, for example, this might mean that your professor said 75 is passing, but criterion referencing can be arbitrary or it can be based off of some prior study or data. So, what about for substance use testing? We usually use both of these. We use norm referencing, the current referencing dependent on the group, and we use criterion referencing. Typically, it might be based off of the criteria for a substance use disorder. So what are norms? Norms are based off of test performance data of a particular group of test takers and is designed to use as a reference for evaluating or interpreting individual test scores. Basically, we're asking the question, what does your score mean compared to the rest of the population? Norming is the process of gathering norms. A normative sample is a group of people whose performance on a particular test is analyzed for reference, being representative of a group. It has enough people to create norms, and it's got enough people in every section across the norm sample. So this is what the process of norming looks like. First, we start with the norm, the sample, and the population definition. Basically, who is your intended population? Who is the test designed for? And who are your comparison groups? For example, is it college students, women, children, adolescent, adults? Are you using the correct norm for your client? Then we head to sampling. This is the process of acquiring a norm sample. They should be representative of the population that you're pulling from. What is the quality of sampling of the test that you are using? For example, Test A sample or norms are college students from Texas Tech University. But you are using Test A for a 45-year-old client who's not a student. Is this the correct test for your client? Then we would head to standardization, which we will talk about next. So first I want to talk about the different types of sampling. There is simple random sampling. We are literally just randomly selecting people in a sampling frame. Then there is systematic sampling, where we might pick, we're sampling from every like 5th person, 10th person, 11th person. Then there is stratified random sampling. This is a pick of a stratification, maybe gender, age, group, drug of choice, and randomly sampling from those groups. It's also important to recognize why the specific strata matters to you. For example, gender, age, group of drug of choice, etc. There's also proportional stratified, which is a subset of stratified sampling, where you choose the number of participants per strata based on their proportion to the population. So let's say we wanted to choose drug of choice. We would look at what is the typical norm of the population who uses each of those drugs, and then we're choosing a number of participants that represents that population. Another subset of stratified sampling is disproportional stratified. This is a proportion per strata is picked, but is not similar to the proportion in the population. So we are picking a specific number of each of the drug of choice, but it's not representative of the norm in the population. Then there is cluster sampling. This is picking a cluster of elements, not individuals, from the sampling frame. For example, we would pick elements of cities, schools, and families. One stage cluster asks you to randomly select clusters and include all individuals from that cluster. Stage 2 cluster asks you to randomly select clusters, then randomly select individuals. And so it can be multi-stage clustering. Then we have sampling method. Convenient sampling is individuals who are available and can be conveniently recruited to participate in your study. This is a lot of how sampling is collected. Quota sampling is the process that requires identification of groups within a population, the number of people that should be included in each group to form the ideal sample, and the selection of the sample using convenient sampling. Then there is purposive sampling. Researchers know the characteristics of the target population and then seek out those individuals who have those characteristics to include the sample. There's referring sampling or networking sampling. This relies on referral to recruit participants. Starts with a probability sample of the population, so those that have a connection to the target population, and then asking to provide contact information for potential participants. There's referral sampling, which is the snowball sampling. This relies on a referral to recruit participants. So research participants who volunteered are then asked to identify others who will meet the same characteristics. Then there's volunteer sampling. Whoever volunteers, researchers get participants from, for example, ads posted on social media, bulletin boards, discussion boards, etc. Next, we land on standardization. We have to specify clear and a specified procedure for administration and scoring, controlling for everything. We want to minimize error. Imagine how norms will be different for people if you're in a noisy room versus a quiet room, if it's really hot inside the room or really cold inside the room. We want to make sure we're minimizing the error by the environment that we're producing. Note that for administering tests, try to make your test administration as standardized and error-free as possible. However, it's also important to recognize that error is inevitable. There will always be factors that affect the scores of a test. Errors from the test taker, errors from the test administration, like the environment, maybe the examiner mumbles or is bad at giving instruction. Error in the test scoring. Maybe the scorer or the checker doesn't score it correctly. There can also be error in the item or test selection. Maybe the construct isn't actually recognizing the behavior of the sample, but you cannot get the behavioral sample. Maybe there's bad items or tests for that population. Then there's systematic measurement error. This is when the measurement also taps other constructs as well. So it's measuring other things that it wasn't intended to measure. And then there's just random error that just happens. So when we're evaluating whether a test was good or not, we're also looking for error variance. This is the classical test theory. Error variance is a component of a test score attributed to sources other than the trait or ability that is specifically being measured. So again, let's look at Bob's score of 85. The test administration error, there's test construction error, there's a true score, and then there's random error. The assumption is that the test taker has a true score in a test, except that it is contaminated by error. So what we strive for is to minimize error. We want to reduce how much error we see in this individual's test score. So we want to think about how can we prepare and pre-prepare your testing environment and the procedures to reduce this type of error. Here are some considerations in mitigating errors. Before the test, make sure the robustness of the test, which we'll talk about with the reliability and validity, there's development of appropriateness of the test, and there's ease in the administration and scoring. This will help reduce the test taker's error and the test administration error. During the test, mitigate any extraneous variables in the administration. Having fidelity in the manualized instruction, so making sure that it's consistent. Ethics in working with sensitive or a protective population. Helping reduce the risks and increasing the benefits, as well as recognizing autonomy and self-determination. After the test, we want to have fidelity and consistency in the manualized instruction of scoring and interpreting the tests, knowing the limits and bounds of the test scores, and translating those scores in a way that the client will understand them. This ends our lecture slide for good test taking. However, you will want to watch the reliability and validity lecture slide to learn more about how to recognize a good test.